Hi everyone, welcome to our webinar on Healthy Start. I'm Nicola Goldsborough. I'm an Advanced Health Improvement Specialist in the Children and Families Public Health Team at Leeds City Council, and I'm joined by Alice James Hopton, who's an Assistant Digital Inclusion Officer. So we're just going to be telling you a little bit more about the Healthy Start scheme in Leeds. So we'll cover the strategic context, provide a bit of an introduction to the Healthy Start scheme, look at eligibility in a little bit more detail and the application process. And Alice is then going to talk a little bit more about digital inclusion and becoming a Healthy Start champion. So the Healthy Start work in Leeds sits under the Best Start strategy, which is a big strategy in Leeds where the vision is for every baby in Leeds to get the best start in life. And there are 5 key outcomes. So we have healthy mothers, healthy babies at a population and individual level. Parents experiencing stress are identified and supported early, well-prepared parents, good attachment and bonding, and development of early language and communication. So the Healthy Start work very much sits under our outcome around healthy mothers and healthy babies. And this work also aligns with the fact that Leeds is striving to become a mom city. And really, all of this work is encompassing reducing the inequalities that we see in Leeds. So just to talk a little bit more about the inequality in Leeds. Leeds is a city which is characterised by wide inequalities between those who are living in the more affluent areas of Leeds and those in the more deprived areas of Leeds. So this map here is just showing in the darker purple those who are living in what we would describe as the 10% poorest nationally. So that translates to 24.3% of the whole population in Leeds are living in the 10% most deprived nationally. 31.9% of under 18s, and then sadly nearly 34% of our under 2s are living in the most deprived areas in Leeds and classified as the 10% most deprived nationally. So as we can see, huge disparity in the city. And just a little bit more on food poverty in Leeds. It's reported that around 60,000 people have accessed a food bank by referral in 22-23, which represents a 42% increase on the support level required in the previous year. There are some slight issues with recording because food banks and pantries don't have the resource to be recording individuals. So this might represent kind of repeat visits by individuals, but it still shows a real increase on the previous year. The local welfare support scheme figures show that between April 23 and the end of March 24, there were nearly 10,000 food awards given through cash and through vouchers. And with all this in mind, the Healthy Start scheme can be a lifeline for many pregnant women and families with children under 4 in Leeds. And it's a means-tested benefit, government benefit designed as a nutritional safety net to improve access to a healthy diet for low-income families. So just a little bit more on what Healthy Start is. So Healthy Start is a scheme that provides money to pregnant people or families with children under 4 to spend on healthy foods. And if families are eligible, they will get £4.25 each week of the pregnancy from the 10th week, £8.50 each week for children from birth to 1 year, and then £4.25 each week for children between 1 and 4 years old. And if eligible, families will be sent a Healthy Start card with money on it that they can use in most UK shops. And this can be used by plain liquid cow's milk. And it is at the moment just cow's milk, but there is lobbying going on, particularly from the Vegan Association, to try and change this. Fresh, frozen and tinned fruits and vegetables, fresh, dried and tinned pulses, and then infant formula milk, again based on cow's milk. The card can also be used to collect Healthy Start vitamins, and these support you during pregnancy and breastfeeding. And then there are vitamin drops for babies and young children that are suitable from birth to 4 years old. So if a family claim from when a mum is 10 weeks pregnant, the family can receive more than £1,200 for that child. So whilst it can seem small amounts per week, you can kind of explain to families that this does amount to around £1,200 in total. And again, there is lobbying going on to look at the amounts that families receive, particularly in consideration of the cost of living crisis and the rising costs, and making sure that the benefits are going up in line with that. So just a little bit more. The Healthy Start about the Healthy Start vitamins. The Healthy Start vitamins are available to pregnant and breastfeeding people and people with a child under 1 year and children under 4. And the Healthy Start vitamins provide the correct amount of vitamins recommended by the government. So they contain vitamins A, C, and D for children from birth to 4 years, and then folic acid, vitamin C, and vitamin D for pregnant people, breastfeeding people, and people with a child under 1 year old. And these are really important because 8% of children under 5 are reported to not have enough vitamin A in their diet. And families in lower income groups do tend to have less vitamin C in their diet. And all pregnant people, breastfeeding people, and young children are at risk of vitamin D deficiency, with teenagers, young adults, and those from ethnic minorities particularly at risk. And these vitamins can be accessed at health centres and pharmacies in Leeds. So this is just, I wouldn't expect you to be able to read all this information, but it just provides a bit of a snapshot around the uptake in Leeds, and it's broken down by the different wards. So uptake in Leeds at the moment is around about 68%, which translates to around 3,000 families missing out. And this data is for March 2024, but at the time of recording in July, we're still around 68% and 3,000 families missing out, which again translates to around £1 million, which could be spent in Leeds by families on healthy foods not being spent. And this table here just pulls out certain wards which have higher eligibility, and just to kind of highlight, lots of work obviously needs to be done in our areas where there's greater eligibility, but not be forgetting those more potentially affluent areas where there are still families in need and eligible for the scheme. And we do find that in those areas there's a lower percentage rate of uptake, so lots of work to be done across the board. So why would families not be accessing this benefit? So lack of awareness, difficulty in applying, digital exclusion, language barriers, and also we haven't got it listed down here, but there has been some research recently looking at the language which is used to promote the scheme. So we've been calling it a benefit, but there is an argument to kind of portray it more as a child right, to kind of change the perception of the scheme. So it's kind of always thinking about why people would not be accessing it. And if you're going out and speaking with families, it's really good to kind of like feed any of that information back, so that we can change how we might be promoting the scheme in the sitting. And we have included our email addresses later on. So just a little bit more again on who is eligible. So it's pregnant and or have at least one child under 4. And notably, families are claiming per child, and that either parent or carer can apply. Young parents aged under 18 are also eligible, and some families with no recourse to public funds. So as well as being at least 10 weeks pregnant or having one child under 4, families must also receive any one of the following. So it would be universal credit, only if the family's take-home pay is £408 or less per month from employment. Child tax credit, only if the family's income is £16,190 or less, income support, income-based job seekers allowance, employment and support allowance, pension credit, which includes the child edition, or you, your partner, or your carer get working tax credit run on only. So how to apply? You can go on to www.healthystart.nhs.uk/how to apply. If you're on universal credit or child tax credit. If you're applying aged under 18, you wouldn't be able to go on via the website above. You'd have to contact via the email address, which would be healthy.start@nhs.nhs.uk, or call 0300 330 7010. And again, if it's a family with no recourse to public funds, it would be a case of emailing Healthy Start Claim at dhsc.gov.uk. So what information do they ask for? So it would be full name, date of birth, address, national insurance number, baby's due date if pregnant, full names of all children under 4, and date of birth of all children under 4. But again, notably, the application does not ask for information about marital status, employment status, or benefits received. Then again, the criteria for under 18s. So you have to be 10 weeks pregnant, entitled to Healthy Start, regardless of financial income. And if you've given birth to the child, you must meet the financial eligibility requirements to be entitled to Healthy Start. So again, how to apply, it's the, if you're under 18, it's the email address which we mentioned before, and you'd be asked for name, date of birth, baby's due date, NHS number, and national insurance number. And you'd receive paper application by post and be asked to send a photocopy of your ID, such as birth certificate, and these would need to be posted back to Healthy Start, and they would provide their address. Criteria for families with no recourse to public funds: they must have parental responsibility for at least one British child who is less than 4 years old. And again, there's a lot of work going on to try and broaden this so that no families are missing out on the scheme. But at the moment that is the case, and families' take-home pay must also be less than £408 per month, and they must be excluded from claiming public funds as a condition of the immigration status. So just a little bit more information on how those families would apply. So we have the email address, which again was mentioned before, healthystartclaim@dhsc.gov.uk. And in order to apply, parents or carers will need copies of the passport and/or Home Office reference number or case ID if it's known, proof of address, the child's birth certificate, a bank statement, and if families do not have a bank statement, documents that demonstrate they meet the financial criteria. And DHSC will contact as soon as possible if they require further information to help process the application. They will then receive a paper application by post and might be asked to send a photocopy of the biometric permit card that demonstrates they have no recourse to public funds. So all families must inform Healthy Start when the baby is born. So again, notably, families can apply from 10 weeks pregnant, but must inform them when the baby's born and make a new claim. So you'd need to call Healthy Start on 0300 330 7010 and apply for child tax credits as soon as you can, and inform Universal Credit by updating your online account, and then reapply online and make a new claim. So the Healthy Start card should take 5 to 10 days to arrive, and it needs to be activated by calling 0300 330 2090. The card is then topped up monthly, and families will receive an email each month informing them of the next payment. So for anyone that can remember the vouchers, this changed in 2021, I think, and it's now a card which should make it much easier for families to use it in a wider range of shops, because as we'll mention later, stores just need to accept the MasterCard in order to accept the Healthy Start card. So if there are any issues, there's a Healthy Start helpline, which is 0300 330 7010. And if it's in order to activate a card, report a lost card or PIN forgotten or card blocked, or to do a balance check, the number is 0300 330 2090, and that's available 24 hours a day, 7 days a week, and there are translators available. So just a few things before families are applying. Need to make sure that they've updated the job centre on the pregnancy or the baby's birth, and this must be done before applying to Healthy Start. And if you're waiting for the first benefits payment, this must have been received before applying to Healthy Start. And you must make sure that the information that's included on the Healthy Start application is exactly the same as that which is on any benefits awards or letter or job journal. So no misspelt names, or if there's a middle name, making sure it's used on both occasions, because often when applications are rejected, it's due to issues with the information that's provided not being exactly the same. And just a few things to be aware of. So there are call line charges for Healthy Start. They should be included in the call plans if the phones have a contract, but they will cost on pay as you go. So costs are up to 9p from a landline and 3 to 55p from a mobile. And in relation to buying Healthy Start items and non-Healthy Start items, should be able to split transactions between the Healthy Start card and another payment method, but you would need to separate items and do separate transactions if it's a self-checkout. And I mentioned earlier, from vouchers to a card, so it was March 22, Healthy Start gave paper vouchers to use in shops. So those who were on the vouchers must reapply to Healthy Start to receive a card, and they're not automatically transferred. But hopefully that, because it is a little while ago though, that shouldn't be still much of an issue. So where can the card be used? So the card, as I say, can be used in most places that sell milk, infant formula, fruit and vegetables. And this includes supermarkets, grocery stores, pharmacies, markets, news dealers and community food spaces such as food clubs and pantries. As I say, the key thing is that they display a MasterCard logo, and they must be registered with MasterCard as one of the above categories. So just a little bit more on being a Healthy Start champion. Ultimately, Healthy Start is kind of everyone's business, and we want everyone to be able to champion the scheme. So we need champions to make everyone aware of the scheme, and remembering that, as I say, the weekly amount may seem small, but it does amount to over £1,200 per child, and it can help with and it can help to put up information prominently and talk about it with families. And then it can be more practical support in helping families to apply. So if people don't know how to apply, it can be a case of pointing in the direction of the application page and explaining the process, or it might be more hands-on support to get them to sign up. But remembering that you don't need to be an expert, and you know, there's always people to ask if you want any more information, but really just having a think about what you can do in your setting to help promote the scheme, make families more aware of it, and ultimately make it easier for families to sign up and make it more acceptable. So I think we're now moving on to Alice, who's going to talk a little bit more about digital inclusion.
Thank you, Nicola. Yeah, so as Nicola mentioned, most people applying for a Healthy Start will need to access access digital in some way or shape or form, if that's applying online, for the Healthy Start or just emailing. They'll require that will be required. So as part of our work, we at 100% Digital Leeds sort of want to support people to understand digital exclusion and it not just being older people who may be digitally excluded, also younger people, families, working aged people can be digitally excluded for a very varied different reasons. So a couple of key figures on digital exclusion in the UK. 1.7 million households have no mobile broadband internet at home, and I think in 2023 up to 1 million people had to cut back on their internet provision due to the cost of living. So this digital inclusion is widening due to the cost of living. 26% of 25 to 34-year-olds are narrow internet users. That means they use the internet sort of very rarely, up to maybe 4 times per month, and they're not potentially aware of the benefits of that, of digital, of what they can access online, and they potentially only use it when they absolutely have to, which can then lead to somebody like not having the right skills to access when there is something that they need to use because they're not a regular user. And 44% of 16 to 24-year-olds are unable to recognise scam emails. So that another key issue for digital exclusion is people not being confident online. Scams and frauds are very need to have that training in place to be able to understand what is a scam email, what's a scam, what's a fraud, and 24% of those not in work lack basic digital skills. So that's a lot of the people that are eligible for the Healthy Start scheme may struggle with basic digital skills. So digital exclusion increases the likelihood that somebody isn't going to be able to access this well-needed benefit or right of the child, as Nicola was saying. And 48% with no qualifications also lack basic digital skills as well. So the 4 main barriers that we look at when concerning digital exclusion, there are more than 4, of course, but these are the 4 main aspects of digital exclusion that we look to break down. So the first one is skills, not knowing how to practically use the digital tools, technology and services, potentially not knowing that Healthy Start scheme exists, not knowing how to fill in a form online, for example. Connectivity, as we mentioned before, as cost of living challenges bite, increasingly more people are struggling to afford that bill and are cutting back on connectivity because they have no other choice. So not having access to Wi-Fi or adequate data, not having a device or the right device. Some devices, older devices, might not have software updates that mean they're not able to use most up-to-date apps or that might really benefit them. Or broken devices or devices that aren't suitable, don't have the right accessibility requirements, etc. Confidence, as I briefly touched on before. So there's not having confidence in your own abilities, or worrying about digital being risky or unsafe. So that's sort of a twofold barrier, where there's a confidence issue in your own abilities and a confidence issue in the digital tools and services. Some people are worried about inputting their data online because they're not aware or they don't have the understanding of where their data is going and how they're protected and what their rights are around data protection. And finally, motivation. So not knowing the kind of things someone can do when they're online and how digital can benefit them. So I'm sure you might have heard someone say, digital isn't for me, but we have to sort of dig a bit deeper and ask, why do they think that? Potentially they don't know what's available to them, what could help make their life better, might help make them save money, connect with their community, friends and family, manage their health conditions better, apply for Healthy Start. So the motivation barrier is looked at by understanding that people might say they don't want to use digital because they're not aware of what it might do to help them. So supporting people to sign up, Nicola has touched on this. So how can you play a part in improving access to the Healthy Start? As Nicola already mentioned, promoting the benefits, telling people about Healthy Start and the relative ease of signing up. And then you can practically support people there and then to sign up. If you've got the capacity to do that, it doesn't take that long if you have the correct details and documents. So if you catch people when they're using your service, if you don't have the equipment to help people sign up online, you could borrow an iPad from Leeds libraries, and those come with data as well, to help you get online with somebody who's accessing your service. Encourage people, if you are going to do that, encourage people to bring the letter, a benefits award letter, with their details so that you're inputting the exact correct details, exact correct full name and address that's on their benefits awards letter. And finally, if potentially you don't have capacity to sit down with people and sign them up, signpost people to digital support in the community. So we have a community support directory on our 100% Digital Leeds website, digitalinclusionleeds.com, which shows where there's support available across the city, where somebody could go to get some support to sign up to Healthy Start. So this is just a screenshot from the community digital support directory, showing a snapshot of what support there is available, where you can encourage people to go to. It could be if you've got the availability to sort of call up prior and get to know their specific support arrangements. If we click on one of the dots, one of the blue dots, it shows you a brief overview of what each organisation offers, including whether they offer 4G data gifting from the National Data Bank, which might support some of your service users, where they have equipment on site for people to use, equipment for loan, one-to-one skills, and that includes drop-in sessions for people that might be needing help to apply for Healthy Start, for example, and group skills, and what the primary audience is. So there are some organisations that are specifically support different needs. So some support people seeking asylum, refugees and migrants. Some might support older people, people in Roma community, etc. So it's important to note the community support directory doesn't give sort of fixed times and dates of when this support is available. Normally, one of these hubs, somebody's able to go in and find out more, but they might not be able to access digital support 24/7. So it's good to sort of phone up or get in contact prior if you've got someone that might be anxious to do that themselves potentially. The reason we do this is because a lot of the time community support is changing and adapting to the needs and capacity of each organisation. So organisations can also receive support from 100% Digital Leeds, and we can help build your capacity to support digital inclusion to enable you to help people increase their well-being and become more independent and are able to use digital. How we do this, we can advise and support on the development of your digital inclusion offer, support partners to develop your digital skills and confidence, your staff and volunteers to have the confidence to be able to support your service users. And a key factor of that is supporting organisations to access funding and resources where there's a need. alongside supporting staff and volunteers to understand what digital inclusion is, how it affects people, and how to have positive conversations around digital exclusion, and understand the specific needs of the people that you're supporting. We form strategic cross-sector partnerships to address specific issues. One of those is the Aladdin Network, that is a network of organisations supporting people, autistic people and people with learning disabilities, to improve their digital inclusion. And finally, supporting digital inclusion to be embedded across strategies so that it becomes part of your organisational priorities and sort of embedded across the service rather than just being a separate part, so that digital inclusion is considered throughout in order to support your service users, as I said before, to become more independent, to improve their well-being and become more self-sufficient with the use of digital. So that's me. This is my email address, alice.jameshopton@leeds.gov.uk. If you'd like some more information or you would like some support from 100% Digital Leeds, you can contact me. And our website is digitalinclusionleeds.com to find out more information. I'll hand back over to Nicola for the final bit of the presentation.
Thanks, Alice. So it's just building on what we were saying before about becoming a Healthy Start champion, and the Healthy Start national team have just focused a little bit on healthcare professionals and identifying how much of an important part they can play in promoting the Healthy Start scheme. Again, telling eligible people about the scheme and the application process. As we've both said, kind of conveying how important it is and the benefits of both the scheme and the vitamins, and just highlighting that appointments and social care assessments can provide ideal opportunities to promote the Healthy Start scheme. It's really a case of making every contact count. So where we're meeting with pregnant women and people and families, just highlighting this scheme and having conversations around it. Depending on where you are based and what your role is, kind of your role as a Healthy Start champion might look quite different. But if you're wanting to put information up in your setting or have banners on your email or even run a social media campaign, perhaps on your kind of Facebook page, Instagram, there are a huge range of resources on this link that we've provided on the slide, which is the NHS Healthy Start Communications Toolkit. And there's loads of information and resources on here which are really helpful. And there are also various leaflets which have been provided in different languages, which were put together by Lambeth Council. So again, if you're working with a particular community, this might be quite helpful to have resources in different languages. So just a little bit more about what's happening in Leeds. So for those of you that don't know, we have a Healthy Start task group in Leeds, which is led by Public Health and sits under our Best Start strategy. And it's a multi-agency group joined by midwives, health visitors, children's centre staff, third sector partners, digital inclusion. And we're really just looking at what we can do as a city to increase awareness and uptake of the scheme. And this group's been running since the summer of 2023, and prior to that, lots of work was done by Zest. We had a social media campaign which ran from March this year, just a targeted campaign using TikTok, Instagram, Facebook to try and increase awareness amongst certain groups. We also have some Healthy Start banners which are available at the Public Health Resource Centre. Again, if you are wanting to do a kind of bigger promotion in your setting, I know schools and nurseries have sometimes had them when parents are coming and going, and then had some leaflets, and then it provides an opportunity to discuss it with families. Similarly, there could be more of a promotion at a certain food bank or pantry or the baby bank, and we have been working with different groups to look at how we can increase awareness and have conversations, and also provide that practical support for families. So if there's perhaps an outreach session from the Leeds Baby Bank, whether there's that opportunity to get people signed up there and then. We've also been doing work with Leeds Kirkgate Market to ensure that the market store holders that are accepting MasterCard are accepting the Healthy Start card and are promoting this. So we need to do a little bit of an evaluation of that, and really just continuing awareness raising and training and linking with digital inclusion, and continuing to campaign on various things which I've alluded to during the presentation around investment and uplifting and expanding eligibility for those with no recourse to public funds. And a lot of these campaigns are led by Sustain and Feeding Britain. And if you want to have a look at their websites, there's lots of useful information about and towns across the country. So that's us for today. Alice has already provided her email address. Mine is here, nicola.goldsborough@leeds.gov.uk. If you want to kind of provide any feedback or information or access any further information, please do just get in touch, and we'd be really interested to hear kind of any work that is happening around the city to help families sign up. So thank you very much.